Okay, it's my pleasure to have with us this morning in this series I'm calling Reflections from Pharmacy Leaders Advancing the Profession, Dr. Michael Cohen. Dr. Cohen is founder and president of the Institute for Safe Medication Practice, or ISMP. He has served as chairperson of the International Medication Safety Network. He has also formally served as a member of the FDA Drug Safety and Risk Management Advisory Committee and also the Non-Prescription Drug Advisory Committee. He's a recipient of the John Eisenberg Patient Safety and Quality Award from the National Quality Forum and the Joint Commission. And he's also a recipient of ASHP's highest award, the Harvey Whitney Award. He's recognized as a MacArthur Fellow, and he's been granted honorary doctorate degrees from numerous universities. He also recently received the Harold Godwin Leadership Legacy Lecture Award. So it's my pleasure to welcome Dr. Cohen.
Thank you very much. How are you, Therese?
I'm great, thank you. So the first question I have for you is, we'd like to learn about your journey in your career and your position and recognition as a leader. And when reflecting on your journey, you may wish to reflect on key events that shape that direction and also key people who influence you in your journey.
Okay, sure. So do you want me to start out when
Yep.
I graduated from pharmacy school?
Whatever you want. You don't have to say where you were born and the year you were born, but yeah, whatever shaped your career, and people will come in at different points in that.
Right. Well, I was always interested in science, and my father worked in a pharmacy. He was not a pharmacist, but he worked in a pharmacy, and he would have me go with him like on a weekend or something to the pharmacy, and they get me to dust shelves or put stock away or whatever. I did that as a teenager, and eventually decided, to go to college and work in a community pharmacy the whole time, right up until and through pharmacy school. And I had a job at a community pharmacy as a pharmacy intern, and I really liked my work and decided I was going to go into community pharmacy. I was lucky in that at Temple University School of Pharmacy, which is where I was a student, they had just begun a clinical pharmacy course in the year that I was graduating, the year before I graduated. And I also had a hospital pharmacy course. So I had some practical experience with that over at the hospital. And the director of pharmacy, Neil M. Davis, was there at the time. And I interacted with him a couple of times, and he saw me teaching a patient at the pharmacy window, which he was, I guess, a little impressed that a pharmacist would do that, which I thought, was not that unusual. But at any rate, I had Dr. Davis also as a professor for the hospital pharmacy course and the clinical pharmacy. And after I graduated, I got a full-time job in community pharmacy. I was absolutely thrilled. And a few months later, I get a call at 7 o'clock at night. It's Dr. Davis on the phone. And he says, I have a job opening at Temple University Hospital. I think you'd be interested. It's going to be up on a men's surgical ward. We're opening a satellite pharmacy, and I'd like you to consider it. And I flat out told him no. I loved what I was doing in community. So I was married at the time. And he called my wife at home right after he hung up to me. And he talked my wife into talking me into coming to Temple. And I started working at the hospital about 3 weeks later and never looked back. I've been a hospital pharmacist, did a little relief work in community early on. But while I was at Temple, I actually had the opportunity, thanks to Dr. Davis. He had the journal Hospital Pharmacy. He was the editor, and he got me to write a couple of articles for it. The first one was gastrointestinal intubation. Here I am working up on the satellite right outside this men's surgical ward. And I didn't know what a Levin tube was. I didn't know what a St. and Blakemore tube was for esophageal variceal bleeding, and so on and so forth. So I became an expert in gastrointestinal intubation and wrote an article on it. And I did some other articles as well. And along the way, I had an interest in cardiac arrest. I did a column in the journal Hospital Pharmacy for a few issues. And then all along, working up on the satellite, of course, we would have some things that would go wrong as far as medication are. And I would tell them about it. And after a while, we had a couple of other pharmacies as well, and they would tell me about it. And he got me, put me aside one day, and he said, why don't you think about writing a column on these medication errors? Other people could learn from it. The guy was kind of a genius and way ahead of his time. And I really owe a lot to Neil for my career path, because that was it. Once I learned about, preventing medication errors and just concentrated on that, my career took off. In fact, I think that is something that I learned. Specialization is so important, for having a successful career, really, becoming what you think you'd like to work towards being the world's expert in a particular topic. And for me, it was medication safety. And my first column was published in March of 1975. And, after about 15 years of that, we had enough material for a book. After another 10 years, we did another book and then another, and interested the United States Pharmacopoeia in picking up on, making this a national reporting program. And we did that, and then began to work with the FDA. And, it really, really took off. And I finally realized in about 1993, 94, this could become a full-time effort. I was working all along as a hospital pharmacist, not just at Temple, but I became a director at another hospital as well. And by 94, we actually put together a nonprofit called the Institute for Safe Medication Practices. I came up with the name myself. Neil had retired by then. So I did meet up with another pharmacist who I met through the State Pharmacy, Hospital Pharmacy Association, PSHP, Alan Beta. And Alan and I, put this whole thing together about the nonprofit and putting a board together. And Alan joined us in 1998 or 1999. He's still with us full time. He's our executive vice president. We've hired nurses. We have a physician medical director, and it's really taken off. People do know us. We have a newsletter that basically gets to every hospital in the country. We have four other newsletters for community, nursing. We have long-term care and consumer. And so that's kind of our flagship product, the newsletters for communication and how we communicate about ours. And all of our folks, we have about 25 employees now, pharmacists, nurses, our medical director, really have become expert in medication safety and educate, publish. And so, that's pretty much it in a nutshell.
Wow.
That's where we are today.
Thank you very much. Thank you for those words and those insights. So what do you believe is going to be your legacy in 20 years? I think you already have a legacy, but so reflecting on all your different contributions, what are you most proud of that really has helped advance the profession? And that's kind of, I don't want to say it's easy, but I think get you to
I think, some of the issues this week in our newsletter today, we just learned that, we had actually requested that FDA remove syringe administration of vincristin, because that syringe sometimes was accidentally mixed up with one of the intrathecal drugs in a syringe,
right,
and injected, and basically the patient would die every time that happened. It was a horrible, horrible type of death where things progressed over time through the central nervous system from the lumbar puncture site to the brain, and eventually the patient would stop breathing. It was very painful. And I'm happy to say that this week we learned that the syringe is no longer in the package insert. So it has to be diluted in a mini bag. And we have over 130 deaths that we know of from that syringe. So it's that kind of thing. And we've seen it with, many other very, very serious situations where products are no longer on the market or were renamed or, system changes were made by FDA. It's just so many things the staff has worked on over the years, put it together, and we get the buy-in from not only FDA and the pharmaceutical industry, but the provider organizations and the individual practitioners out there. And that's what I look at, and know that, they're not even going to remember Mike Cohen's name, 20 years from now or whatever, maybe even 5 years from now, I don't know. But those things will be out there and no longer hurting people. And that's what's important to me and what's important to my colleagues here at ISMP. And we've seen that quite a bit. So if you're looking for what I would consider the legacy, I guess, we have focused on system changes that have prevented a lot of harm and a lot of deaths over the years. And we're very proud of that, I have to say.
Very good. Thank you very much for that. So as this is, students will be listening to this and others, but what advice do you have for students in their professional journey as they develop as leaders to help advance the profession?
Yeah, like I said, find something that you really like to do. I hope it's pharmacy. If it isn't, then, find something else, I guess. I've had, friends and colleagues that have gone on to dental school or medical school, or, I know someone that sells tires now, and he's doing very well, and he loves his job. But I think, as pharmacists, I would go back to what I said earlier about, specializing, becoming expert in a particular area, really enjoying what you do. To me, that has been, the reason for the success that we've had. I work with, I think if we have any negative, it's that I'm working with the same people for the last 20 years, There's not a job turnover because these folks really love what they're doing. Some of us are even postponing our retirement to we can stick with this kind of thing. So that I would say is most important. Stick with it. It doesn't happen overnight. You really have to understand that things don't change so rapidly. This Ben Christian situation I just talked about, God, we started that probably 20, 25 years ago.
Wow.
That's crazy, that we would have to wait that long. But people didn't believe in they were blaming people for injecting that drug intraspinally. That's where we started with this. And it took a long time to start convincing nurses that, if you put it in a mini bag, there's no greater chance of extravasation and tissue injury than the syringe. They're the same. You don't have to stand there and watch every minute of administration. And, there were other things that we would have to do to get that changed. And so, you have to wait sometimes to get to that success. So that's another thing I think I've learned. We don't necessarily rush things. I've had other things like that too. We got the ratio expression out of the epinephrine labeling, epinephrine 1 to 1,000, epinephrine 1 to 10,000. That's no longer in the labeling because people didn't even know what that meant. And we had confusion between the 1 to 1,000, which is 1 milligram per mil, and the 1 to 10,000, which is 0.1 milligram per mil. Now we just have metric labeling. We put a formal petition into USP 10 years before that actually was changed in USP Chapter 7. Mm-hmm. So you have to be patient is basically what I'm saying with some of the things. You keep trying. You don't give up. And I think I've learned that in this field that things do take time. I wish they worked faster, quicker, and sometimes they do, but sometimes you do have to wait things out and just keep at it, keep trying to convince people and do it in a positive way. Don't be negative about things. People don't like that. They like happy people. They like it when, you approach things from a positive manner. It's always about the patient. It's never about you. It's never about your workload. You need to get this done to save lives, to prevent harm. And we have had a lot of serious injuries that don't happen anymore because we've been able to wait them out.
Excellent, excellent. Thank you very much for those insights.
Sure.
So as this, these interviews are being embedded in a history of pharmacy and leadership course, as we study the decade of the 2020s, one of the key events in that decade will be the COVID-19 pandemic. And like other events that occur in our history, it shapes our profession. It also creates an opportunity for the profession. How do you see the pandemic, the COVID-19 pandemic, being an opportunity for our profession and shaping our profession?
Yeah, well, one of the things we're doing right now is working at home, using communication technology that didn't even exist maybe 10 years ago as it does now. And we might have had to meet at a meeting in order to do a face-to-face interview like this before. So, and that gives us some new opportunities. We're able to reach a much larger audience at less expense. We do a thing called the practitioner in residence, where people had to fly in to ISMP and stay with us for a week at a hotel. So they had the travel expense, they had the hotel expense, and then they would also, we would charge them a fee because it takes our entire staff away for almost a week. And we have only 4 or 5 people at the most that come to our office to do that. We can do it less expensive now by video. We can do almost the same exact thing. And, we can still have those conversations. We can still show our educational material. So, we're learning things like that, reaching a larger audience. So, yes, there are definitely opportunities like that we've run across. And then, I think in community pharmacy, probably some of the same could be carried out, better ways to communicate with the patient. I've always wondered why we don't spend more time following up with patients when they have prescriptions filled. Are they having any adverse events? How are they using the drug? Are they missing doses? All those kinds of things could be done, with a fairly quick phone call. And now we could even do video in some cases. So, I think there's a lot that we could do. Even, we did consulting. Our expertise is in medication safety. We probably could reach a lot of hospitals and sit there with their pharmacy and therapeutics committee or their safety committee and go over some of the issues that they have that they want to tell us about, that we have expertise in, that we might be able to help them. So we're always trying to think, what is out there. And the COVID-19, really changed things. We're no longer working in the office right now. Does that mean, maybe we would have less expense next time? We do need an office. We have, materials, we have files, there's still paper, there's containers of old drug errors and stuff that we have a museum. So we still need an office somewhere, but do we need the same square feet? I don't know. We're just always thinking maybe just a few of us need to go back into the office now rather than everybody, because we're able to work from home. We actually have a staff meeting now every week on video. Before we only did it once a month. Now we're sticking together. We see each other. So yeah, COVID has presented some unusual opportunities for us that we've picked up on.
Excellent, excellent. Great insights. I really appreciate. Well, Michael, Dr. Cohen, it's always a pleasure. Thank you for doing this.
Thank you, Therese.